Good afternoon. My name is Dr. Russell Cephas. I'm a certified missiologist, and I've recorded 9 videos and a series of 10 videos on the coronavirus. I want to encourage you to go to my YouTube channel. That's Reverend R.E.V. Dr. D.R. Russell Thomas Cephas. That's C-E-P-H-A-S. And view the series of videos on the coronavirus. Please subscribe to them and don't forget to like them. This particular video recording is entitled Going Back into Society, Re-Socialization. Going back into society, re-socialization. What many medical authorities have feared the most is now at the doorsteps of Americans. The stringent push to reopen America by the President of the United States may prove to be a decision that will cost the lives of millions of Americans. In what many consider to be the apex or the pinnacle of the coronavirus pandemic, now a decision is made to send 50 million, 70 million, 80 million Americans who are unemployed back into the workforce, and many more to go back into society and associate with the general populace. This may prove to be a decision that would cost the lives of millions and millions of Americans. The President of the United States has pushed for the reopening of America in the middle of the pandemic. 8 weeks ago, there was deliberate, intentional conversation about forecasting when America would reopen. There was already a deadline set for America opening again, regardless of the death toll increasing, regardless of the coronavirus spreading like wildfire. A decision had already been made at the pinnacle of the pandemic of the coronavirus. This careless and reckless thinking was totally antithetical to the opinion and decisions of medical doctors, of scientists, of those working on the front line of the coronavirus pandemic. Emergency room doctors and nurses, health officials from all walks of life, from all dimensions of the medical profession, all agreed that a hasty decision would ultimately be a deadly decision. The virologists who study viruses disagree that people should re-enter society. The epidemiologists who study the spread of viruses and other deadly diseases that are contagious all say no. but ignoring the advice of health officials, ignoring the advice of medical doctors, ignoring the advice of scientists, ignoring the advice of those working and laboring feverishly 24 hours a day on the front line, there still is a push to send millions upon millions of America back into society. Again, this may ultimately prove not only to be a nonsensical decision, but a deadly decision as well. A premature decision to reopen states and encourage re-socialization amongst Americans can unquestionably lead to unnecessary death and unnecessary loss of life by people that have weak immune systems, by children who also have underdeveloped and weak immune systems, by senior citizens, 52 million Americans that are senior citizens can be affected. In fact, we know from statistics the coronavirus attacks those with weak immune systems and the elderly and children faster than any other populace in America. As of April 27th, governors from 5 states across America carried out their procedures to reopen their states. All of them did so against the advice of the federal government. The federal government had issued guidelines that no state should reopen without at least having 3 weeks of declining rates of people contracting the coronavirus. It's almost unbelievable that governors would violate a precautionary measure and allow the citizens of their states to go back out into society, to go back to work without any proof statistically that the coronavirus rates have gone down in their respective states. This is not just a crime against nature, it is a crime against humanity. Many consider this to be a political decision, not one in the best interest of the people of their states. The reality is nothing has changed about the coronavirus. 8 weeks, 9 weeks, 10 weeks ago, a popular slogan came into existence and many Americans adhered to it. Stay inside and stay alive. That was 8 weeks ago, 9 weeks ago, 10 weeks ago. And now today, let me tell you, my friends, nothing has changed. Virologists say nothing has changed about the virus. Epidemiologists say nothing has changed about the spread ratio or the dangerousness of the coronavirus. The coronavirus is still a killer and could be considered even a silent killer. Now with new information that 50% of people that contract the coronavirus may be asymptomatic, meaning they have no symptoms. There is no elevation of fever. There is no cough. There is no diarrhea. There is no headache. There are no respiratory problems. But yet, they are a walking time bomb. looking for people to infect unknowingly. They're asymptomatic, having the disease, spreading the disease, and not knowing it at all. Nothing has changed about how deadly this disease is. And so one must conclude that this is a political decision and a financial decision, but not a decision in the best interest of humanity. The only thing we know that has changed is that the coronavirus now is more deadly today than it was in weeks gone by. Please be advised that the following are suggestions on making the best decision for abandoning your isolation, for abandoning quarantine, for abandoning the safe places of your homes and your apartments and your respective domicilial dwellings. Before you go outside, before you re-enter society, before you go back to work, please consider the following 8 things. Here they are. Number 1, people with pre-existing medical conditions such as asthma, diabetes, heart disease, the elderly, older people with weak immune systems should not consider re-socialization at this time. I repeat, should not consider re-socialization at this time. These persons are more susceptible to disease and infection than other populations or populace of people. Number 2, people who know that their re-socialization demands that they associate or work with other people in a close social environment that have not been tested for the virus, or people who have symptoms of the coronavirus. There are many social places where people gather, where people have not been tested. There are many workplaces that people are being called and summoned back to, where there have been no testing for the coronavirus. Number 3, people should not consider re-socialization until they have been tested to determine if they have the coronavirus. Just because you've been shut away in isolation from the general public, just because you've been by yourself or with a few people in quarantine, does not mean that you do not have coronavirus. You very well may be asymptomatic, having the virus, but without symptoms. The smart thing to do, the intelligent thing to do, is to be tested to determine if you are a carrier of a contagious disease by the name of coronavirus. Number 4, people who have recently experienced symptoms of coronavirus. What are some of those symptoms? A high fever, respiratory problems, otherwise breathing problems, coughing, sore throat, headaches, and diarrhea are all symptoms of coronavirus. They should not attempt to re-socialize or return to their workplaces until they've been examined by a medical doctor. Number 5, people who have been treated for coronavirus must verify that they no longer have the coronavirus. This is done in the following ways. Number 1, they no longer have a fever. You're no longer running a high grade fever. You no longer need medication to keep the fever under control. And then number 2, you no longer have respiratory symptoms, breathing problems. You are able to hold your breath for 20 seconds or so. And then number 3, critically important, you must have two tests done in a 24-hour period. And both of your tests for coronavirus must come back with negative results. Number 6, people should not re-socialize in states that do not meet the federal guidelines. The federal guidelines call for, once again, that state having a reduction in the rate of people contracting the coronavirus for 3 weeks in a row. If your state does not qualify, then you should stay inside. Then, in addition, you must do social distancing, staying away from other people at a distance. You must have a face mask. They must have a face mask. You must wear a face mask, number 3, and other protective clothing to protect yourself, to protect your life. You do have a future that you want to experience. You can't experience that future if you're dead. You must go for retesting. And then number 5, you must only go into crowded places or areas where people are wearing face masks. I see the television where thousands and thousands of people are flooding to the beaches. I don't see one person with a face mask. I don't see one person protecting themselves or protecting other people from the contagious disease, the coronavirus. Number 7, people who can afford to stay at home should definitely stay at home. If you have a little money after these 8 weeks of quarantine and you can afford to stay there for another week, I know quarantine fever is driving some people cuckoo. They can't wait to get outside. They can't wait to be involved in social activities and extracurricular activities. But if you can wait a few more weeks, if you can afford to keep buying food or having food brought to your house, then please, I beg you, I plead with you, stay inside and stay alive. Number 8, people should not return to their workplaces. If you know that your workplaces poses a health risk that could cause you to be exposed to coronavirus, people should not return to their workplace if you know that at that workplace people have died. You shouldn't return to your workplace if people in that workplace have been tested positive for coronavirus. You shouldn't return to that workplace if you know that people are not wearing a protective mask or other clothing to protect them and you from contracting coronavirus. People do not receive on-site testing at your workplace. That is, as they're reporting to work in the morning or whatever time they go to work, if they're not trained people there issuing a test to check for symptoms of coronavirus, you should not, under any means, return to that workplace. I want to give you a few tidbits, a few bits and pieces of information about wearing a protective mask. Surgical masks are best. They're better than other masks. In addition to surgical masks, there is the mask that is identified as the N95 mask. Certainly there are all different types of masks, and any of them can help you, but those are the best. Before you put your mask on, always wash your hands with warm water and soap, and if need be, some alcohol. Number 2, make sure your mask has no gaps or holes where air can get in. For the most part, your mask should cover your nose and your mouth, not just your mouth or just not your nose. Make sure that it doesn't have large openings where air can get in. The coronavirus travels through air mass, and the particles of the coronavirus is in the air, and you can contract coronavirus that way. Number 4, after taking your mask off or while you're wearing your mask, do not touch your mask with your hands, because you can affect your mask with coronavirus from your hands. After you take your mask off, then wash your hands and follow the same procedures as putting your mask on. Number 5, if you're wearing a disposable mask, then dispose of the mask. Don't try to wear it 2 times, 3 times, 4 times. Your life is more valuable than that. And then finally, masks that are reusable can be washed in warm water and soap with a little bit of alcohol and dried and wore again. Thank you so very much for listening to this video that has to deal with going back into society and re-socialization. My name is Dr. Russell Cephas. I'm a certified missiologist, and I'm moved with compassion for people around the world concerning the matter of the coronavirus. God bless you.